But while you are vaccinating a large number of citizens, you are also adding a large case load. You know, the fact is, many believe you were successful in the first wave in your containment strategies, but maybe Kerala let its guard down in the second wave. It started with the elections in Kerala in March, April. Then there were pressures on your government to open up shops. You did alternate days opening up of shops, but now we are seeing Bakrid relaxations a few days ago were allowed. Your critics are saying that the Kerala government, especially during the Bakrid, should not have allowed the relaxations in this ad hoc manner for 3 days. Either you allow complete relaxation if you believe the situation is under control, but you can't allow it for 3 days for a religious festival. Did you let your guard down, ma'am, in the last few months in the second wave? Did you get overconfident?
This was the case during the first wave too. You may be remembering, because in January 2021, we contributed the maximum number of cases in India, and I remember almost 50% of the cases in the country was from Kerala during January 2021 too. Why? Because we have always tried to drag the wave. We have always tried to keep the number of patients or the number of positive cases below the max medical capacity threshold. In Kerala, there was never a case where there is a patient who died without getting oxygen or without getting hospital bed or without getting ICU facility. So we always tried or we ensured that all our people, those who are infected, all the positive cases, they do get hospital aid, and they do get oxygen support, or if they need ICU support, we ensure that they are also getting ICU support. And in this phase, if you go through the data, you can see that the hospital occupancy is very less. And as I told you, the test per million in Kerala is very high. When you compare the total population, we only have around 3 crore 51 lakh people in our state. But when you compare the tests done with the total population, it's very high. Also, we are doing targeted tests, and also it is because of the Delta virus. Yeah.
No, ma'am. I am not disagreeing with the achievements of Kerala. I'm not trying to minimize your achievements. But the fact is, I asked you about letting your guard down, especially during Bakri Eid. The relaxations for which even the Supreme Court has pulled up the Kerala government warned that you should not have done it. Do you believe in hindsight that some of those were mistakes, like Bakrid relaxations, that some of those districts now where numbers have gone up like Malappuram is a worry? Could that be because of relaxation and allowing this overcrowding during these 3 days? Are you under various pressures? Merchants and traders want you to open up, religious groups want you to open up, and the Kerala government is in a bit of a bind.
Sir, during those days also we had TPR was around 10, 11, 12 like that. And here we have a coordinated effort, all the coordinated activities of all the departments, the police department, the LSGD, the health, and also the people are cooperating very much to control the disease. And I'm so sorry to say that it's quite unfortunate that there is a campaign against the state saying that the system has failed and all. But when you see the virologists, the experts, when they say that Kerala is a system in Kerala is very good still now. Why? Because the density of population in Kerala is very high, and it is double the national average. So here we have more than 860 people in 1 square kilometer.
Ma'am, density of population is also there in Mumbai, but cases are coming down. Let's not. I mean, my point is, ma'am, you seem to have no regrets at the moment for allowing any lifting of restrictions. I'm just trying to understand that questions will be raised. Onam is coming. Will you allow similar restrictions and will you allow similar opening up? Will that lead to another spike? It appears that while you tell me on this show that you have the situation under control, the fact is your government has just today announced a further clampdown or lockdown on 30th, 31st. Does that suggest that are you worried in a way that you're now going to have a strict 2-day lockdown over the weekend?
So we cannot keep the people in a lockdown, or we cannot keep the people in their house, shutting their their shops or their institutions and all. So the government of Kerala is vigilant in this part of in this phase of the second wave, and these 2-3 weeks are very crucial, and we are closely monitoring the situation.
No, but the very fact that you've decided to enforce this strict weekly lockdown, does that mean in a way that you've realized that while you need to open up and ensure that livelihoods are not lost, at the same time the worry of these 20,000 plus figures for the last few days means that you can't lower your guard and fully open up? Kerala is caught in a bit of a bind.
So we have weekend lockdowns. We have lockdowns on Saturday and Sunday, and we are asking our people to remain in their houses during Saturday and Sunday. This is a collective decision. It's a collective decision of the state, and it's a decision of the review committee chaired by the Honorable CM. And all the departments are there in that committee, and the health department will give all the data, and the committee will review the situation in the state. And we have categorized all our LSGDs, all the panchayat, municipalities, corporations according to TPR. So from 0 to 5% TPR, if we give relaxation, and from there will be more relaxations in the group from 5 to 10, and from 10 to 15 there will be more relaxations, and it will be like that. And there will be triple lockdown in those LSDDs where the TPR is more than 15%. Why the TPR is high? Because we are doing